Hey everybody, this edition of Lionheart Radio is brought to you by the world's first creatine coffee. Each scoop is a full cup of a Colombian Arabica bean coffee infused with 5 grams of a creatine monohydrate. Now here's the deal, guys. A lot of people have differing opinions about creatine, and unfortunately a lot of really shitty supplement companies have tried to sell it to kids that want to get big, and they package it as some kind of steroid alternative, and they tell you if you cycle it and if you stack it, then you'll gain a bunch of muscle mass. And at the end of the day, none of that is true. What is true is that it's one of the most studied and beneficial supplements on the market for strength, recovery, and endurance. So whether you're a runner, whether you are a strength athlete, or whether you're somebody that wants to enhance cognitive function and just feel healthier in everyday life, a pharmaceutical-grade creatine monohydrate is going to help get you there. Go to www.creatinecoffee.com to learn what all the hype is about. And now, on to the show. Welcome back to Lionheart Radio. I'm your host, Rick Alexander, founder of Lou Aviv, based in San Diego, California. And I'm here with Claudia.
Hi guys, Claudia Challoner, Doctor of Physical Therapy and nationally ranked powerlifter. And we have a very special guest today, Dr. Meghan Helwig. She's a Doctor of Physical Therapy and owner of Primal Strength. She is a former Division I athlete, a triathlete, and now a CrossFitter.
Hi guys.
So today we're recording inside of a gym, kind of. So it might be a little bit echoey and you might hear some barbells dropping in the background. Just ignore it. It just makes it all more real. So you got your background in Division I field hockey?
Yes.
So do you want to kind of take us back from the beginning? Like, where did your sports journey kind of begin?
It actually kind of began when I was born. My dad was a professional golfer, and from as early as I can remember, my whole family, I'm the oldest of 5 kids, we all were active in sports, swimming, field hockey, golf. I played competitive golf all through high school, swam competitively through high school, and then ended up taking a scholarship to play field hockey in college. So that's kind of how it started.
Oh, nice. And you were a field hockey goalie?
I was. So I was a goalie at Villanova.
Oh, nice. All right, I might be wrong here, but is field hockey the second biggest sport in the world? Have you heard that before? Behind soccer?
Really?
Yeah.
There's a men's sport, so it's like a men's sport, like, and it's huge in the Olympics and stuff.
Yeah.
The U.S. team, like, you'd have to see how we all rank, but usually, like, playing against some of the men.
Yeah.
Holy crap.
So, do we have a men's team?
Mm-hmm. Yeah.
And we're in the Olympics? Or we don't make it?
I don't know how far along we go. I don't want to offend them. I don't know. I should know.
Gotcha.
But no, there's a lot of, we had a guy in high school that came over internationally, and that's all he played, and we wanted him to play so bad, but everyone, like, made fun of him. But he was, like, amazing.
Oh, really?
But it's a huge sport overseas.
Yeah. So you originally you were going for finance originally, and then so how did you decide, because now you are a doctor of physical therapy, so how did you decide to kind of make that switch?
So I was working in New York City actually for a couple years post graduation. I graduated in 2003, and I was training for a half Ironman triathlon, and I could not run getting off the bike, and I was only like a month out from, it was Eagle Man in Maryland, and I could not run getting off the bike. My knee kept locking, and one of the girls that I swam with was like, oh, go over and see this guy. He does ART. He'll fix you up. And that was kind of my first experience with, well, at least ART and kind of rehab. Mm-hmm. And I was like, I like this so much more than sitting at a desk all day. I was like, I cannot deal with, sitting still. That was still not my personality. And that kind of got me thinking, do I want to go back, like PT, chiro, PA? And then I even thought, like, maybe be a teacher so I could be off and train and have, like, the schedule that I could do both. Mm-hmm. And then I ended up going back, but I only took bio for the business major. So that was my only science. So I had to go back and do, like, a year, 2 years of all the sciences to even even apply for PT school. So
what was your undergrad, Claudia?
Well, I studied exercise science. I had a Bachelor of Science, but I had taken a few years off to personal train, so some of my classes had already expired for PT school, so I had to retake anatomy and physiology, and I had to take some chemistries too, so... And of course, they're like chemistry 1 and 2, so you have to take a year to do that.
Yes.
But yeah, all fun stuff that I'm never going to use again.
No.
Ever.
Exactly.
And so how did the story end? You went to the physio, right? And then he worked on you, you were good?
When I was working in the city, but it was like one of those like glamorous outpatient, like all pro athletes there. I'm like, oh, this is what I want to do. Not knowing that like, yes, I still had to do an acute care in the hospital rotation, like nursing home, all this other stuff. Like there were so many other aspects of that, but being an athlete, like I kind of knew the niche I wanted to be in. So that's kind of how it started. And then luckily the company I was with in New York had an office in New Jersey. That's where I was living at the time on the East Coast. And they let me transfer there while I went back to school at night to finish all the courses. So then I started back in 2006 with PT school.
Nice. And so, but you were able to like work through the knee injury?
I think I only saw him like 3 or 4 sessions, and then I did the whole half Ironman with no pain.
Really?
So I knew like ART, active release technique, was one of the techniques I wanted to get certified in right when, and I my first course I took when I was still a student, because you got like a discount as a student to take it. So I had started that, and that's like, just because it worked on me and I was a believer in it, you know, that was one of the first techniques, and then I kind of built from there.
Do you have to be a PT to get certified in ART?
I think you have to be either a PT, chiro, a licensed massage therapist, or a athletic trainer.
Okay. So do you mostly work with endurance athletes, because that's kind of how you got your start, or?
I had a big mix. For 7 years, I was working at a ortho sports clinic in New Jersey that was affiliated with the hospital. Mm-hmm. So we did see a lot of post-surgical. So it was like a big mix. And since we were part of the hospital, we also had the Medicare and also like charity care. We saw a little bit of everything, mm-hmm. but we were attached to like a speed school. Yep. And then we also had a tri team within our group. So we kind of saw a little bit of everything. And then for a little bit, I branched out on my own, and I was at Baldwin Golf Club, which was doing golf performance.
Okay.
So.
Golf must be a PT haven, huh?
It is.
Yeah. All that twisting.
Because you're doing a bit of golf work now, right?
I do. I actually was
just in Santa Barbara?
I was up in Santa Barbara this weekend up at Don Parsons Golf Instruction.
Okay.
So I go up there once a month, and like Friday I'll see a bunch of the clients one-on-one. And I'll talk to the pros and see what they're working on in their golf swing. Like one of the girls is having trouble transferring her weight and can't get over onto her left leg, or one's not rotating well. And then I do like my one-on-one assessment, breaking down the body to see why they're having trouble. Yep. So then like trying to fix those things and then send them back out with the golf pro to work on their swing and see if now they can get into those positions that they were having trouble with before.
With something like golf, do you find that when an athlete in their sport, they do a lot of rotation, and then do you actually prescribe them training as well? Because even if you fix their problem and then they go back to working out all in like one plane of motion, they're still kind of set up for failure, do you think? Or
I think all like any function, like I basically prescribe, like I'm looking at functional movement patterns and giving them movement patterns that either simulate what they're trying to get into, correcting any kind of dysfunction. Because I always say any good athlete's a good compensator. We're great at cheating. If we have a little bit of pain, we'll just move differently.
Right.
So we don't feel it.
Yeah.
So I think a lot of the stuff I give them is just to reinforce those patterns once we identify like the relationships.
So, and then you said you went and got your ART. Mm-hmm. So that's something that I think, like for me, has come in handy a lot when I'm lifting, right? Because a lot of joints just they help. Like I found the ART helps to open up that joint. What about endurance? Do endurance athletes, could they benefit from ART? So
ART is actually branded with Ironman. So for 5 years, I would go up to Ironman Lake Placid because I was on the East Coast living in New Jersey, and we would work on the athletes. Like they would just line up, and we would be there for like however many hours, and you were just seeing like there was one day we saw probably 200 athletes between like all of us in the tent. And it's just ART. That's all we're doing on them because we're there just with ART. And you're up there for the week. So and they respond really well. And a lot of like Ironman, whatever, like when you get to that level with certain things, like they're in tune with their body. They know what they're feeling. Like a lot of times some of them will come up to you and be like, here's a list from my ART provider that I would see at home. This is what they normally do. Can you do this on me?
Is that easier for you? Like, do you like that? Or is that like when someone Googles all their symptoms and then goes to the doctor and they're like, this is what
in those kind of settings, you're not really able to evaluate anyone. So if you kind of have a short list of maybe what works for them, it kind of helps you in like almost like a wham bam kind of situation.
Yeah.
Versus like if someone was coming to see you, you don't really want.
Yeah, because you don't have a lot of time. Like, it goes against how I like ethically, like how I treat, because like people come in and like it hurts here. I'm like, well, that's probably not the problem. Yes, it might hurt there, but that's just a symptom of something else in your body going on. So in the beginning, like years ago, I used ART like all the time. Like this hurt, I was working on all that stuff, and now I've found like combining it with like ART is just a tool in my toolbox of the other stuff I use, and it's actually saved my hands a ton not having to do it all over the place. Because if I can like fine tune what the actual problem is and the why behind that hurts, like why is it hurt, why is it tight, I sometimes don't even have to touch it, and you release something else and the pain there will go away. Because that was actually working too hard for something that wasn't working. So if you can get something that like wasn't working to come back online and retrain, it's all motor control in the brain, like telling the brain's what tells everything to move. So if you can actually reprogram that, then it saves me a lot, and it also saves them a lot of their time because you can fix things a lot faster.
Yeah, I think I've talked about this on a podcast before, but when I originally started training for ultras, and I was like, oh, I have shin splints, and then I went to a girl with ART, or a girl who was had ART in her toolbox as well, and she was like, did a bunch of work on my feet, and I was like, now I don't have shin splints. So I guess I didn't have shin splints at all. And really it was I think my arches were so tight that it was like pulling, I don't know.
Oh yeah, like something, like shin splints if they were in the front, you work on the back and all of a sudden the front pain goes away.
Right.
You know, like that front to back relationship, like agonist-antagonist stuff. Like, I mean, I have stuff now where I'm working on people's scars, and scars from years ago, but you cut yourself, or even if like you go in for surgery and they're going in to fix something, your body still senses trauma. Your body still senses like, you're cutting into me. That's like, what are you doing? So your body's going to react and protect itself. So I work on, now I find if I correct the scars first, the muscles will go back online. Like sometimes I don't even have to like I'll muscle test someone and things will test weak and I just correct the scar and then everything else tests strong again. And I didn't even have to do any like strengthening. Like they tested weak and then all of a sudden they test strong by just correcting some scar work. You know, it's more of the brain. It wasn't that it was weak. It was just a signal to the brain was being intercepted by something else that was guarding or protecting itself.
And is that where the neurokinetic?
That's where I learned that with NKT, and then a combination of like, you know, kind of putting it all together, just looking how the movement pattern is. But a lot of the stuff I use is the NKT, like the muscle testing. So
for the listeners and for me, what is NKT?
So NKT stands for Neurokinetic Therapy. Basically, it's, you know, muscle testing, but you're muscle testing to look for that neural input to see if the brain registers. Like when you test, say you're testing the glute max, is the glute max actually kicking in right away? Like depending on how you test, and we say sometimes the better the athlete, the lighter I'll test because they're better at compensating or pulling something in to help cheat or compensate.
Okay.
So, you know, you can test it for like endurance, you can test it for strength, you can test it just for like sometimes super light just to see if it kicks in, and if it doesn't, but then I'll ask like the history is a huge thing. Like if I know you had a certain scar or a certain thing and something's not really firing, I might just touch that scar while I test it. Or even before I do that, I'll muscle test everything, see what's on, what's off, and then I'll go test the scar to itself. Like,
when you say scar, what are you talking about? Like an actual scar?
Like an actual scar.
Okay.
Yeah. Like it could be like an actual physical scar, maybe like
a C-section.
Like a C-section too. Or like a lot of times like women won't even remember like if they had a kid, if they actually tore. Like when they gave birth, they had, and that's scarring. So sometimes I'll have them, I'm not having them go under their pants, but like over their pants, put their finger where the scar was, and then muscle test, and it changes the testing.
Okay, and then when you say muscle test, what are the parameters that you're looking for? Are you looking for muscular response to an electronic signal? Or
so like when I'm asking them to like hold their leg in this position and then I'm like resisting it to see, and like the way I hold it, the way the body's angled, all that will all dictate which muscle I'm testing and what like alignment I put the client in when I test will like kind of dictate where I'm testing in their body. Or like I'll have them in standing and I'll test patterns, like trying to twist them or trying to push them over one way, trying to push them sideways to see if they could stabilize. So like I'll test patterns and then I'll also test muscle or even ligaments. Like you can test ligaments or you can test tendons, but you have to use, we call it like an indicator muscle. So I use another muscle somewhere in the body that I know responds properly, and use that while touching in certain ways a ligament or a tendon or a scar. Yeah, to see if the signal's there.
Interesting.
Yeah.
Is NKT new, or has this been around for a long time?
I think I took the first one maybe like 5 5 or 6 years ago.
Okay.
And it's kind of like grown a lot since then, where like I took one of the original ones and then it's changed and there's like a level 2, there's a level 3 now. So there's different levels of it.
Yep.
Now they're starting to break out. They're actually going to start an equine, I think, and a pelvic floor, 2 different segments
Okay.
stuff. Because they actually were doing with surrogate testing on animals, which was really cool.
Rock Tape even created an equine taping course.
Yeah.
What can you bring that down? 57 education
We're both
levels?
into horses.
Okay.
So before I wanted to be a PT,
Equine
I actually,
horses.
yeah. So my whole life growing up, I wanted to be a veterinarian.
Okay.
I don't like reptiles, but I was like, if I can do everything but reptiles, and that was going to happen. And then I actually thought about becoming like doing equine and canine PT, but in New Jersey back in like 04, 05, I think when I was looking, you had to be a vet tech or a veterinarian. Like PTs couldn't do the equine stuff. So I was like, oh.
And this neurokinetic,
I was like, fine, I'll do it with people.
Therapy, is that NKT?
NKT.
And they do this with horses?
That's something new. I don't know if it's out yet, but I know they were developing.
Okay.
There's a lot of things that they do that cross over from physical therapy to like horse therapy and even dogs. Like, I mean, there's physical therapy for canines.
Yeah, they have the treadmills, they have the underwater treadmills, they do like the rock tape and stuff like that.
Yeah.
And like when I took my first kinesio tape course in like 09, I think, there was 2 trainers there that were the horse trainers, and the tape worked better on horses than it did on humans. Like a horse that couldn't jump, and they would just tape the horse and the horse could jump. I know, it sounds
I don't
crazy.
know if you're fucking with me right now.
No, 100%.
Totally.
It's
Totally.
crazy.
Yeah.
So Rock Tape, the company that we all know in
Yes.
CrossFit and different sports,
Yeah.
they tape up horses,
Yeah.
and that's a legit thing.
It's legit. There's a course actually later this month. I was gonna go to it, but it was kind of expensive.
Yeah.
Okay.
Where is it? We should just kind of like.
It's in Bakersfield.
Who is more cutting edge, humans or the horses? Like as far as therapy, like are they doing things on horses that are ahead of what we do on humans? Or is it comparable? Do you even know?
I don't really know. I feel like.
Sure. I don't know. I think some things might work better on horses because they don't overthink things like humans do.
Okay.
You know what I'm saying? Like, so
I don't know if they come up with all the excuses or the thinking basically of all this stuff, like overanalyzing everything.
Yeah.
Because a lot of that stuff too, like you start thinking about even just certain injuries and stuff, a lot of it has emotional components to it. Or like where you hold your stress, past trauma.
Yeah.
There's a huge thing now of some like trauma release stuff, doing all these other things that like you don't realize you're holding this tension in your body, and it's your subconscious.
Mm-hmm.
Like part of the thing that I like to do, and I think we talk about it in SFMA and some of the other techniques like Gray Cook and the selective FMS and SFMA.
Yep, that's the functional movement screening.
Mm-hmm. So basically it's like when you come in with pain, like you're like, it hurts here, but like say pointing at their elbow or something, it might not actually be the elbow, but the client thinks my elbow hurts, the pain's here. Mm-hmm. So then it's my job to go in and do the assessment to bring it to their consciousness, being like, look, this is like the dysfunctional patterns I'm finding. This is the true cause. The pain here is only a symptom. So once the patient can understand that in their bring it to their consciousness that might not be the actual cause, then they have a chance to start correcting things. And then eventually, like you can do some soft tissue work, whatever it may be, or whatever techniques you use to correct it, and then give them movement patterns, and then they can do the movement patterns, and maybe it takes effort, so that's still like more conscious like effort, but then eventually if they do it enough, it becomes subconscious again. So now they have like a functional subconscious pattern, whereas in the beginning it was a dysfunctional pattern, where now we can retrain it back to.
Yeah.
So it's like you almost like when I was in school and like all the neuro stuff, I'm like, I don't know if I want to do neuro.
But neuro is ortho.
But now that's all it is. That is everything. Like that's totally how we work. It's crazy. You wouldn't think of it that way, but now like it brings you right back to it.
Yeah.
I feel like the idea that something can cause emotional trauma and manifest in physical pain is like new, or it's like becoming. I'm at least just starting to hear about it more.
Well, I think they're doing more research on it and becoming more aware of certain things. But, I mean, there's a huge component on, stress and all of these other components in your life of how they can affect inflammatory responses and injuries, previous injuries that you've had, or maybe a current one.
Or like
Yeah.
Like the biggest thing I talk about with every single client now is breathing. Like, so we don't even think like when we're born, that's the first thing we do. And like, we should have normal breathing pattern. But if you ask someone to do like a belly breath or breathe, some people have no clue. And they're like breathing all from their chest and their shoulders.
Yeah, like lifting their shoulders
And
up,
they don't realize it and they don't know how to breathe from here.
Mm-hmm.
But then you ask maybe their history and maybe they did have asthma. So it could have been just like they had trouble breathing, so they would try to breathe more. But if they had like an anxiety or a panic disorder, or they had a lot of like, trauma or stress at home and they were super scared all the time or fearful, that will change their breathing pattern. Or even just like an abdominal surgery, like they had their appendix taken out as a kid.
Mm-hmm.
You have that scar there, you don't want to breathe from your belly because it hurts. So you guard that area, and then all of a sudden you just developed a new pattern. So you compensated, but your diaphragm's attached to it's attached to everything, like your spine, your ribs, your core, like your pelvic floor, all that stuff. So if the breathing's off, all that other stuff's off. So we don't realize that like breathing alone can change so much.
Yeah.
But that goes back to like just retraining that, and the brain can reset like so much stuff. So like the past few years with all this stuff, it's kind of changed how I think about things, and even how I treat, like even just from ortho sports to, everyday,
Right.
people with pain.
Yeah.
So this might be a little esoteric, but I'm gonna put it out there anyway. Have you ever heard of somebody breathing into where it hurts in order to reduce pain? Do you know what I'm talking about? Have you ever heard of that before?
No.
Okay, then I'm not gonna bring it up because I don't understand it enough.
Later episode.
Yeah. When you are doing a functional movement screening on somebody though, how are you ruling out physical pain, like trauma versus emotional, in order to figure out what's really going on? Like, what's your process or how could people figure that out for themselves even?
I mean, there's a lot of sometimes people just avoid a lot of stuff in their life. They don't want to think about it because it's going to bring up other stuff. But like I had a client in the past couple months, and I was working on her, and just something didn't seem right. Like I just had that feeling like I needed to like dig deeper on her, like about history and stuff. And that's sometimes like you have to make sure you feel like that they trust you.
Sure.
In that relationship. And I was like, do you have any other scars maybe that you're not telling me about? Like, I didn't say it that you're not telling me about. I'm like, maybe is there any other scars or surgeries you had that like maybe you didn't remember? She's like, well, there was one, and it was huge. She had a hysterectomy at a young age. But she's like, but that scar healed so well, you can't even see it. And like when we looked for the scar, I could hardly even see where it was. But when I started to I was like, I asked to touch it because I needed to use it for testing. I just got this weird like sense, and when I was working with her, I started to get super emotional, and I was like so, and then I stopped, and I was like, because if you kind of cross that line where they go, we call it like going limbic, like their limbic system, like emotional, it's gonna bring up all this stuff. I asked her, I was like, did you have a lot of emotional trauma or stuff go on with that surgery? And of course, because she couldn't, that was how she couldn't have kids.
Right.
So I was like, is this something you want to deal with? Is this something that maybe you've dealt with when you had that surgery, like maybe if you needed to go to therapy, if you needed to talk to someone about it? And she's like, no, yes. She's like, if it's affecting my golf game, we're going to fix it. I'm ready to fix it.
Right.
I'm like, okay. I was like, I just wanted to check and make sure. She's like, no, I'm ready. But it's something where I got like, I almost got like super emotional when I was working on her, and I could feel it, and I had to back off because I knew there was some weird energy going on. And maybe my first couple of years out of school, like, I don't know if I would have felt that, but as you start to work and you get comfortable and like touch, and you can kind of feel where there's tension in the body, like you can start to feel it, and I felt it right away.
Yeah.
And she almost started crying because she's like, no one's ever like found that kind of connection. But when we went in on that scar, it changed everything, and now she's been like ecstatic because now she can actually transfer her weight and get her weight through and rotate in her golf swing, which she was getting lessons for years. And she was getting better, but she was getting stuck all the time. But it was like one of those things where it was like a fine line we had to walk to make sure we didn't go too far too fast. Yeah. But we never know, like a simple little scar, what really the profound impact that surgery meant, like had emotionally on the person.
Right.
Like what else went into it other than just, having that surgery.
Yeah.
But just even injury in general, like it has a huge emotional connection with it, whether it's an athlete or
like
especially down the street, especially for athletes.
Yeah, because it's like our identity.
It takes us out of what we love and like our life and we don't know what to do.
Especially if we
can't
use
do
that sport as like, not as like a coping mechanism, but if we use that as like our outlet.
Yeah.
Like that's like our outlet. That's how we're like,
identity.
that's like our happy place. That's where we go when we want to like really stress. That's where we go when we want to like, you know, so many different things. And then all of a sudden that's taken away from you because of an injury. Like it has so many, like it affects you in so many aspects of your life, but then it can actually physically affect you and how you move and your movement patterns. And if you don't clear them up, maybe that little pain goes away. Years down the line, all of a sudden you're like, I have this other pain that came out of nowhere. Like so often I find when people have pain that comes out of nowhere, it's actually something that they were compensating or some pattern that they've developed over the years that finally the tissue's like, I can't handle this pattern anymore, I'm breaking down. So it's been interesting to see like some of the emotional and different stuff coming up and just different patterns. Like it's almost like you take one layer away and then like other stuff comes up. You take another layer away and you're like, oh, I haven't had this in years, but it's because you just took away all the compensations that they built around that.
Yeah. And I think that's a lot of the reason, like, just for anybody listening to this, why why you should go see a PT is that they have reps looking at all of these different things. And obviously I'm preaching to the choir here with you guys. But like, even for myself, I feel like I'm really in tune with like myself as an athlete, my training and everything. But, I thought I had shin splints. I go to this girl for like 2 seconds and she sees exactly what's happening.
Yeah.
It's always good to have someone else's, even if you know a lot about like yourself, even physical therapists, like we have to get our own treatment too. Like you have to have other people's eyes on you to be able to, plug out some of these deficiencies or dysfunctions.
Yeah. Well, and it's just like even having a coach, right? Like that objective view that's outside of your situation.
Exactly.
Because we can't test ourselves. Like so often I'm like, I wish I could just test myself right now and I can't.
Right.
Yeah. See, so everyone needs that. So it's important. But also seeing a physical therapist that understands where you are, like if you are an athlete or something like that, like you need to be able to communicate with someone that understands like where you're coming from.
We're not going to say, okay, don't do it and go rest for like 4 weeks.
Yeah.
That's the last thing. Because if someone told me don't do it and just go rest, I'm like, well, what's the point? I'm going to go rest and I'm just going to go back to those same movement patterns.
Right.
Anyway, there may be a case where we've done like there's trauma where it actually has to rest. Like that might actually be the case, but most often, like if you can catch it before then, like that's why I'd rather see people before it gets really bad or before it's a big traumatic injury. When you start to feel things that are a little funky, clean that stuff up and you're just never going to get to the point then where hopefully you're out of commission for a little while. Like, because I've gone through that. I've shattered my clavicle. I've gotten hit by a car training on my bike and like torn, a bunch of stuff. And that was like the hardest time is when you couldn't train.
Yeah.
It's like, it's a mental test. You go through like the phases, like the morning, like at first like you're so mad and depressed, like right after the surgery, I'm like in the sling on the spin bike. I'm like, I don't know if I should be doing this, but I need to move, but then like you get mad and like you go through like that all the phases. Then you're like good at getting lazy for a little bit. Cause I'm like, I can't do anything. So I might as well just hang out. But, you go through all those phases. So like going and seeing someone that actually understands that, and then they're not going to be like, go rest and just ice it and you'll be okay in like a few weeks. Like,
right.
No. But
how long were you down for when you got hit by a car?
That one wasn't as long. I just tore my pectineus, which is a small little muscle in the groin and like abdominal stuff. So I was out for like 4 weeks and my labrum in my hip, but not getting that surgery because that's an ugly one. So it was like 4 weeks. Okay,
and is that when you were training Ironman?
That was before Lake Placid. Yeah, so that was before that. The one like 5 or 6 years ago, I shattered my clavicle in a bike crash too. And that I was out for a while because being a PT, like I couldn't use my arm, I couldn't treat. So I was out it happened in August, I had the surgery, and then I wasn't back to work until the end of December or so. Oh, wow. So that was when I started coming out to California. That was when it got ingrained in me coming out here, but yeah.
So I saw on your website, what is your website? It's
primalstrengthpt.com.
Okay.
Yeah.
So I saw on there, in your bio, something about your Ironman ranking in like 2015.
Was it 2015? I think it was all world.
It was like top, all world. What is that?
I have to remember. I think it was like top 5% or 5 or 10% in the world for Ironman.
That's
so it was good. Like that was like I was always. It was like my dream was to like go to Kona. You know, and that year I knew I got a coach.
Yep.
If I was going to do it, like I wanted that one shot to, you know, I never had run a marathon except for in Ironman.
Nice.
I don't like running. That's why I was a goalie. I didn't like to run.
Yeah.
But I was like, if I'm going to have to do a marathon, I'd rather swim 2.4 miles and bike 112 before I have to run the marathon, you know?
Sure.
Just the thought of I know, maybe that's why. But, you know, got a coach, went through all the training, was super excited, and ended up getting like hurt, I don't know, like a month or two before. There was a couple other races I did that had a lot of sand running in it, and after that we had to run over some dunes, and I just had this heel pain that my calf just locked up and I could not get rid of the heel pain. So, you know, I had an awesome race. The weather stunk that year. They pulled us out. I was already out of the water on the bike, but they pulled everyone else out because of thunder and lightning.
Oh, wow.
So they didn't count the second loop of the swim for anyone that did finish it. They took those times out. You know, but I was doing well. It was a great race. I was out in like first or second in my age group on the bike, and then going into the run, but then you had the run. So you can swim a lot faster and be done, you know, only a few minutes ahead, but then if someone runs 2 minutes per mile faster for a whole marathon, they're done and like hanging out for how long before, you know, so it was good.
Swim doesn't matter.
No, so I was out in an hour, and they have like a 2 hours and 20 something cap, but like, and my bike broke at mile 70, so the last, or 40, mile 40, so I think the last 70 some miles I was on in 1 gear.
Oh, really?
Yeah, I was so mad. Part of the frame broke, but I could still ride it at least.
That she needs to go in your bio.
70 miles, like,
Yeah,
I think my max RPMs was like 142.
And the Ironman on a single speed.
Got my cruiser out here.
Yeah, so I was like, I want to get like redemption on the course, but I'm like, the thought of training for that again, like, the race day is just like the reward. It was all the training going into it.
Yeah, it's a
you
lot.
know, so I was like, let's see if my body's even capable of handling that.
So what did your training look like going into that? And you weren't CrossFitting at that time.
I was like, no, like I had done a figure in a bikini show, like lifting stuff, like back in 2010, gotten into the tries, and then built up from like Olympic to half Ironman to Ironman. But that year I had a coach who was more like old school coaching and wasn't really big on the lifting kind of stuff.
Okay.
So I was not lifting at all. He's like, if you want, you can add in your own little lifting routine. But I was so exhausted from like 16 hours of cardio a week.
Is that what you were doing? 16 hours
like
a week?
Mondays was kind of a rest recovery day. I would just swim, like an hour swim. Tuesdays I would do like a swim and a run or a bike run. Wednesdays was a 3-hour bike and like an hour run. Thursdays,
it's like a brick workout.
Thursdays was like something like a run, bike again. But like Saturdays would be a 6-hour bike ride, like towards the end, you know, with a little bit of a run afterwards. And Sundays would be a 2 or 3 hour run, you know, so like I was not in the mood to go do strength training, but now looking back on it, how important, I think that's part of the reason I broke down is I wasn't doing the strength training.
Yeah, I mean, that's something I've noticed with running ultras. When I take strength training out, I start like running into problems and I put it back in, and then for whatever reason, my joints, everything.
Oh, I feel so much better. Yeah. Like, and it's even now, like if I get back into like, because I wanted to get back in and I was going to race last year and then I had a stupid toe injury that kept me out. But, you know, if I start getting back just into like, because it's all one plane. You think of it, it's all running, you're all one plane with all that. And it's just so like, if I like find a happy balance with the lifting and the endurance stuff, that's when I feel my best.
So if you could go back and do that, would you cut down on some of the cardio and increase the strength training, or what would that
I'd probably
look like
cut down and make sure it was more useful, like more quality stuff instead of sometimes just trying to get the time in and add some of the strength training in. Yeah. Like that's what I regret not doing. I mean, like I never squatted. I think being a Division I athlete, like we didn't squat. Like they had us go on machines and stuff like that. I mean, it's all changed now there, and like they have an awesome program now. But back when I was there, we didn't as much.
Well, I think that was a lot of
people that just didn't know back then.
Strength
Like it's just changed,
sports, They were
or even like female versus the male sports. Like they didn't have the girls doing all like the other stuff versus the guys were probably doing that.
Every high school football team, I was talking to an athletic trainer about this the other day, every high school football team has been doing the same bigger, stronger, faster shit program for like decades. And it's just like, we are so far beyond that right now. Like totally. as fitness community, like we're past this. We're past tricep pushdowns.
Yes. We're not doing a bodybuilding show, come on.
So do you feel like that's a common mistake for a lot of triathletes? Like,
It's the strengthening stuff.
Or is it starting to
Or even just,
transition over into getting some more strength into people's
like even just
programs?
runners in general, like how often do runners have, like, I mean,
Oh, yeah,
sprinters
totally.
versus like endurance, like strong hips and strong glutes.
Yeah.
You know,
Yeah,
it's usually like their calves are compensating. They have like super tight calves because they end up compensating with their feet or their calves
For what?
for hip stability
Okay.
or for glutes, or hip flexors super tight. Think of the cyclist too. Hip flexors super tight, you know, inhibiting or shutting down the glutes. Certain things, like, so there's just a huge imbalances that, you know, like when you're doing that many hours and that much training, I should have been taking that much time. Like my coach was good and he's like, you need a massage at least once a week or like every couple weeks, just making sure you're staying on top of all this stuff. But there was so much other stuff I could have been doing that I wasn't doing. Just because, you know, they're not, I mean, it's different personalities, but like I was tired, like that many hours, you know.
For sure, totally.
Yeah.
I was like, no, I'm not going to do that today.
Yeah, and that's kind of why I'm wondering, like, would you have cut down on the cardio? And, yeah.
Oh yeah, I would have changed how I did that and made sure, like, almost put a priority on some of the strength training. Just core functional training stuff.
Yeah.
Like I would have kept squatting and I would have kept doing some of the other stuff.
Like what? Like, so would you stick with compound lifts? Like, so for people that are into running or whatever, if they're looking to start strength training in addition to their endurance training, what would you recommend?
I mean, I wouldn't want someone that hasn't been doing it to just go and start doing any kind of loaded stuff because form-wise, like I would want them to have someone to kind of even assess them because I would not want them to load something if they can't even get into good functional form. Because just knowing like what I looked like trying to, like my first squat assessment, I was like, it was pretty ugly. And I'm like, I thought I was a decent athlete. And it wasn't that long ago that like my air squat was hideous, you know?
Yeah.
So.
And you CrossFit now?
I do.
Okay.
It's only been like a year and a half though, so.
And what is your opinion on CrossFit for endurance athletes?
I don't have a problem with it. You know, it's gonna help them. You know, if they're smart about it and they go to a gym that has good coaching, that's actually gonna be like, okay, you need to you can't be doing that with that kind of form.
Yeah.
You know, the other thing is you get endurance athletes. We have a mentality. You know, we're a little type A. Sometimes we're a little competitive.
Yeah.
You know, so then you don't want the person next to you beating you. So that's when we're at risk for getting hurt is like, you know, we're super fatigued and you want to like beat the person next to you, you know, and I've admitted I've done that. I mean, we should be in it for ourselves, but you know, it's nice to have that push from someone else. That's what makes us push ourselves harder too.
And that's one of the most effective parts of CrossFit is if you're working out on your own, you just won't push as hard as you will.
Knowing the person next to you might be a little ahead of you, and that just gives you that little extra push to keep going. Where in your head, if you're by yourself, you're like, you know, like it's easier to talk yourself out of something when you're by yourself versus, you know, they're not quitting. I'm not quitting if they're not quitting.
Yeah.
Kind of thing.
Are there any essential lifts that let's say their form is okay or they have someone to look at their form, so loading isn't an issue? Are there any lifts that you think are essential to endurance, like squat or?
Oh, I'd say squat, deadlift.
Is it too hard to?
You know, if they have good form, if they have true good form, you know, that's only going to help build posterior chain. That's where everyone needs it.
Yeah.
I feel like how many people, they might be an endurance athlete, but then they're sitting at a desk all day for work too. You know, so that's like you're just shutting off your posterior chain and like getting super tight in your hip flexors, and then you're going to go jump on a bike for how many hours? You know, we're just going to get even more tight. So it's like back squat, front squat, deadlifts, like all that stuff. Even just the pulling, even pull-ups, all that other stuff. You think swimming too, all that stuff. It's going to carry over.
Yeah. I spent like the last 2 months working posterior chain specifically because in long runs it's like I'm just noticing it breaking down, and then my quads will be smashed because they'll be compensating for so long, and on goes the problem. But. Yeah,
and that's a lot of times the people that come in like with the knee pain. Half the time I see them with knee pain, it's not really their knees. Yes, their knees are working way too hard and doing way too much because the hips aren't stabilizing, or the hip flexors and quads are super tight, affecting how the kneecap for the patella is riding in the joint.
Yeah.
So you correct like the hips, you correct the other stuff, the knee pain kind of goes away. And sometimes you're not even really playing with the knee that much.
Yeah.
But it will change.
When runners are having low back pain, I think I've been hearing that a lot, like recently from newer runners. What do you think? Can you paint that with a broad brush? Can you kind of figure out where's that too naive of a question?
A lot of times when people are having back pain this is just my general kind of observation, but they are in an extended position when they are running. typically, like low back arched. So like tight hip flexors, they're just leading into that, which, you get into that position, like Megan was saying, tight hip flexors, tight quads, and then also combined with overextension of your lumbar spine, arching your back, then it's just gonna shut off the glutes even more, and so then it's making it harder.
And like one thing I kind of stress with everyone, like, because a lot of times we know the right stretches to do. Like you're like, oh, my hip flexors are tight, I'm going to stretch them. But like, what I try to stress is, why are you stretching them? Are they really tight because they're weak, or are they tight because they're strong? If they're tight because they're weak and you go and stretch them, then you're just setting yourself up to get hurt more. So your hip flexors could actually be tight and you're feeling back pain because they're weak. Mm-hmm. So your body is sensing, I don't feel safe. They're not stable enough. So let me tighten up. Or like people with hamstrings, super tight. Like I can't touch my toes. My hamstrings are tight. They like smash the crap out of their hamstrings all the time. Well, guess what? Like your hamstrings are tight for a reason. It's your body telling you, don't go farther. I don't feel safe. So if you could figure out the why, and that's what I'd like, it's getting outside that box. Like if this is what's bothering you, it's not necessarily the problem. So I've had people that can't touch their toes and are super tight, because they don't know how to hinge at the hips, but also you change breathing. You change their breathing and all of a sudden they touch your toes. Okay. So it's like stuff like that, like it's like getting outside that box, like I said. So like a runner with back pain, think of it, you're pulling with your knees and you're driving with your hip flexors, but could it be the hip flexors are overworking and they're strong, but they're working too hard? Or could it be the hip flexors are actually weak and tightening up because they're fatiguing and they don't have the endurance? So like they might be okay the first like 5-10 miles, but then they're like, when I get to mile 13, then I start to feel this back pain. Mm-hmm. Well, is it maybe the glutes or hip stability is failing at that time? Or is it maybe the hip flexors are actually failing at that time and it's pulling on the back? So that's like trying to testing and figuring out, getting to the bottom of it, instead of just telling them, go stretch your hip flexors. Yeah. Because you might have them stretch your hip flexors and actually could do them more damage than actually good.
Gotcha.
And unless you know the why behind what you're feeling. So it's kind of hard. Like I would love to say, okay, this is what you're feeling. Here's a cookie cutter. Do these exercises and you're going to get better. That would be easy and that'd be great. But we're all unique. We've all had, like, one person might have crashed and has a certain scar that's inhibiting one thing, and another person might have the same exact symptom, but totally opposite, like, path and journey to get to that.
Yeah.
So it's hard that's why it's like, you can kind of like generalize a lot of stuff and give them some stuff that will help decrease the symptoms, but if you actually want to get rid of the problem, that's when you need to get a good PT that kind of looks at things, the big picture of everything.
It's always a whole body approach. Yeah. You've got to look at the whole body.
Like it could be your big toe, because guess what? If your big toe doesn't extend, you're going to leave the ground early and running. Yep. So if you're leaving the ground early and running, you're going to have to use your hip flexor more because you're not getting that, you're not using your glute to extend. Yeah. So if you have a really rigid first toe, you might have back pain because you're overusing your hip flexor, but it's actually coming from your big toe.
What?
Did I lose you on that one?
I'm just my feeble mind cannot wrap around what you just said.
Yeah, no, it's a big thing.
How could your toe be tight?
So your first toe, like a lot of people can't get that extension.
Your big toe?
The big toe. Yeah. Like if you can't get that extension when you're running on push-off, either you're going to start rotating off of it, so then you start rotating. Some people you see like bunions, or you see other like just other patterns. Yeah. But if they can't get there, you're going to pick your foot up early. So if you pick your foot up early, you're not getting that nice push off using your glutes to extend the hip. Okay. So you're not using the glutes, so it's like, I don't have to work there. I'm just going to use my hip flexor to pull through. So you're actually pulling your leg through sooner because you're not getting that extension of that toe.
And how do you figure that out? I mean, that's going to be a nightmare to try to find a problem in the toe.
Oh, not really. I mean, you just look at range of motion.
Yeah. Okay. So when they come in, like I'll usually have them take their socks and shoes off. So I'm looking at them, and when I have them moving, I'm looking like I've had people where you go to push and you see their toes just curl right away, and then I'll be like, oh, when you do stuff, do you like find your toes want to curl in your shoes? And they're like, oh yeah, I rub, like I get or you look at their toes, they all have calluses on the top knuckles. You're like, they're a toe flexor. Like they cheat with their calves and their toe flexors for something else in that whole back line.
Mm. And do you think that some of the technology that goes into shoes now could be causing some of that? Or do you think that...
Well...
Yeah, that could be a whole another...
think about, so high heels for women. Or even all of the shoes that have these really narrow like toe boxes, and what Megan was just talking about with the bunions and stuff, where that big toe kind of goes towards your other toes, so it kind of angles inwards. I mean, that's all these small toe boxes are kind of almost encouraging that. They're not encouraging you to actually have like proper mechanics of your toes. Especially, I mean, just even with walking. That's not even going into running shoes or anything like that.
We put shoes on and then we don't use our intrinsics in our feet that much anymore. Like, think of the dexterity we have in our hands. We should have that in our toes. Like, I mean, I'm guilty of it too. I cannot isolate and move each of my toes like we do our fingers. Yeah. We should be able to do that with our toes. But
really,
we put shoes on and we just move. As we sit here and try. Like, if I hold them down, I can get the other one to go, but the other ones are like trying. We should be able to do that, but we lose it. We just put shoes on all the time, and there's so much sensory input. Like a lot of times before you work out, just roll the arch of your foots out with like a lacrosse or a golf ball. That wakes up so much stuff. Like it could change anything. Like, and some like Dr. Perry and stuff like that, he always talks about, he's like, tape the bottom of your foot, like use that rock tape, just put a piece, that tactile input there, wakes up so much stuff.
You put it across the bottom whole of your foot.
Yeah, just like
a strip just right across the foot. Yeah.
And that helps wake up that sensory input.
I mean, it's just giving that tactile input to that stuff. But I mean, everyone's unique and different. And like some people, if they usually cheat with their toes and their feet, like you could, like you hope you're not feeding into that dysfunction. But like, there's just so much there,
Well, we've talked about it on the show before, like, and when, you go to a running store and they'll watch you run and then they give you a shoe based on how you run instead of changing how you run.
Yeah.
It's like, that the whole, I think it's probably Nike contributed more to that than anybody, but the whole like trying to make your shoe fit how you move instead of the other way around. Like you must probably get a lot of that, trying to undo that.
And then there's the whole thing of that you wanted more arch support and then you wanted less arch support. You want to actually, like, you don't want to, like, it's like when you tell someone, like, to put a back brace on when you're doing stuff, like, you put the back brace on and then people are depending on the brace, so you're not actually using your core, or like, you end up putting the ankle brace on or putting the arch in, so then your foot just stays there, you don't actually have to use your intrinsics to help stabilize. So it all depends.
And then just talking about kind of the CrossFit world, you have a lot of people that have maybe worn these really high arch shoes with a lot of support, like their whole, athletic career or whatever. And then now, like, they're trying to get into a Nano or the Metcon, the Nike Metcon or something like that. Totally different shoe, but of course they're buying it because, that's the cool thing to do.
Yep.
And, like, it's destroying their whole, and nothing against, like, the shoe or whatever, but there was no, like, addressing what was maybe causing the issues of them going into that shoe.
And I admit it, like, being I wouldn't say ex, but it is an ex triathlete right now because I'm not racing right now. But like, I compensate with my calves.
You can say retired.
Yeah. No, I'm coming out of retirement this year. But like, I compensate when I squat. I feel my toes curl at times, and that's something that I battle with. Is like, I compensate. Like when 2 years ago when I was racing, I had to stop even like for a sprint try because I thought my calves were going to explode. I'm like, do I have compartment syndrome or something?
Yeah.
It was my calves were cheating and my feet were like overcompensating for other stuff. But like, I'm guilty of it. I'll look at the workout and that will help me decide what shoes I put on.
Sure.
Or if I'm going to put a little heel lift in my sneakers because I know we have thrusters and I know my form's so much better if I want to have thrusters and box jumps and something else. Like I don't want to wear my lifters, but I also don't want to be doing something with horrible form, and I feel like, because that's my limitation and I'm working on it, but I also will just put like, we had a little heel cup in my shoe because I get heel pain because with my calves being so tight, it pulls on my heel.
That's like when Born to Run came out, and then everybody went out and bought 5 fingers and ran 10K and immediately thrashed their
exactly. You're not ready for that.
Right. So I see you putting out a lot of things right now. As of this recording, we're in week 4 of the CrossFit Open.
Yes.
So I see you putting out things beforehand. Once they release the workout, as far as prehab things that you can do before the workout. Are there things like that for endurance that you would recommend, or does it really, like, if you're gonna run, are there things that you should do other than just dynamic stretching?
And like I always say, a lot of us know the right thing to do. Like a lot of us be like, oh, my hips are tight. but it's also like the why. So I find like a lot of my clients, if we can pair the things and do them in the right order. So if like, say we're hanging out and we're just like rolling out or doing whatever, and you're like talking to someone else, and then next thing you know, it's like 3 or 4 minutes later, and then you're like, oh, I'm gonna just do a little hip activation stuff before I go. Like you kind of lost that window. It's kind of, if you do some kind of soft tissue, you kind of have 30 to 60 seconds from when you do that soft tissue that you opened up a window in the brain to learn something that you want to fire up the opposing. Like say if it was hip flexors, we're kind of cheating for your glutes. Yes, roll out, stretch your hip flexors, and then right away turn over and do some kind of glute activation. So if you can pair the like exercises and the stretches together properly, you'll see a big difference in like, so say for a runner, if it's their calves were cheating for like, that's one of their problems with their hips or something, like do your calf stretch, roll out your calves, and then activate your glutes. You know, if that's the issue, or your core, open up your hips, do like some dynamic walking lunges, but also get in there and do some like sidestepping or something to help with your hip.
And what is the, physiologically, why are you doing that? Like what?
It's like a corrective exercise. It's like, it's basically repatterning.
And your brain
in the
is
brain.
more open to that input?
So if you're trying to like, so if your calves were the ones that were cheating for something, by going in and stretching and releasing the calves, you're like telling the brain, you know, like calm this down right now, and then fire up what needs to work to get that activated. So sometimes it's the pairing and the order that we do things in. If we're not doing them properly, we miss that window to really, like when things get better but it's not sticking, or like it gets better and then it kind of goes away. It gets better, like to get things to really stick, sometimes it's just the order and the timing of the exercise.
Okay.
That'll make a big difference.
Yeah, it's like a lot of people that maybe have an injury or something like that, and oh yeah, well, I foam rolled, or I did the lacrosse ball work, or maybe I even got a massage. It feels so good for like a little bit, and then once I go back to squatting, it just hurts again, or something like that. And so there's usually, like Megan was saying, there's usually like a combination of things. Like there needs to be some releasing or some inhibition of some area, and then also some activation or some kind of work. Like in combination. So,
okay.
Yeah.
Nice. So you're doing the open?
I am.
How's it going?
It's going well. Yeah, so we'll
you
see.
can brag on yourself.
No.
Yeah.
Well, now that I'm masters, it's great that I don't have to go against all the kids anymore because I'm 35 to 39.
Okay.
So you can actually, like last year was my first open. I had just started CrossFit. And I forgot to put a score in, so I didn't even get to see like where I ranked or whatever.
Okay.
But this is the first year like really doing it. So I'm doing well. So they take the top 200, I guess, for the online qualifier. And so there's one more workout, and if, you know, hopefully it's a good one.
All goes well, you're in?
Goes well. I'm sitting like right around 200 right now.
So how does that work? Because then for masters, the regionals is online as well, isn't it?
Yeah, so it's so they don't do it by region at all. It's just top 200 in the world for your age group.
Get to be part of the regional.
No, just an online qualifier. Yeah, the next phase, and I think it's like another 4 workouts or something like that, and you have to record it and submit it in.
Is that like directly following the open, or do you guys have?
I think the dates are on the website. I forget, but there's a little bit of time. But it's funny, like, so Sam Briggs, she's in my age group. You know, like all the original, all the original girls are all like that 35 to 39. So it's like no joke thinking like, oh, you're masters. Like I look at some of their scores and they're just like crushing it. I'm like, one day. You know?
That's awesome.
So it's fun to see like going against them, but it's also fun to see like just in your age group.
Yeah.
You know.
Yeah. Cool. So after the online qualifiers with the top 200, what do they do after that?
I think it's top 15 or top 20. Then from the online qualifiers, top 20 I think go to the games.
Oh, okay, cool.
Yeah.
I wonder if they make that next qualifier like heavier, typically like they do in regionals.
Yeah.
Yeah, it would be heavier and a little harder. Like so I feel like
to try to
some of the stuff like they wouldn't put in,
there.
And I think judging wise too, they wouldn't put some of them in the open just because it's harder to. Judge for some of the stuff. But
so coming from an endurance background, what's better for you? Right? Is it
super long, like 20-minute workouts?
Yeah.
Yeah.
So you'd rather not do the heavy stuff. You'd rather do the more Metcon-y.
I don't mind the heavy. Like I wouldn't say I'm super, super strong. I'm still new. I didn't start squatting until a year and a half ago.
But you're super strong overhead.
Yeah, if you just give me something to lock out overhead, I'm great. Sometimes just getting it there, though. If I had to do a full squat clean to get it there, no. Power clean, yes. My numbers are a little backwards. But,
that happens.
Yeah. No, but like a long workout, like I feel like I finally get in my groove, and then by the end, I'm like speeding up. Or give me just like a long row or something. But they had row in this one, so.
Yeah, but then you get someone like Sam Briggs who just...
Oh, she just go forever. Well, I don't have to worry. Yeah. I'm
So I
nowhere
think she was
near
a
that.
triathlete
Yeah.
too before.
Yeah.
When the Open comes around, you stopped doing CrossFit, what, 2 years ago, Claudia?
No, only like a year ago.
When the Open comes around, do you wish you still did it?
No.
Me either.
I would like stress myself. I remember having anxiety like on Thursday, like, oh my gosh, okay, so it's 5:30, like, or whatever time the time.
Oh, yeah.
And then like immediately like checking your phone like every 5 minutes throughout the entire.
So even though like
weekend.
checking it now it's 5 o'clock, but by tomorrow morning it's still gonna drop more, like knowing other scores got put in. Or yes, I've had dreams in the past few weeks about what the workouts are gonna be.
Oh yeah, it's ridiculous.
I'm like, really? I mean, yeah, so it's like my only second full Open, so.
Yeah.
Yeah.
Last year was my
It's
first
expected.
time not doing it in like, I don't know, a long time.
Yeah,
And it was
that was
like I'd
fun,
walk
too.
into the gym on Friday with like out of care in the world, and I see everyone like stressing out
Yeah.
and like working on technique and going over shit on the whiteboard, and I'm like,
I'm
not
just gonna
me.
go over here and squat.
No.
yeah, I'm gonna
I
bench
did what,
today.
17?
Yeah.
That's what that's what I miss right now though, is because doing this, like the redos, I miss my normal training routine.
Yeah, that it
I
does
just wanna get-
wreck your programming.
Yeah.
Oh, totally.
Oh, yeah.
And it wrecks Jim's ability to program too, because you don't wanna
Everyone's
give
coming in and
anything, like-
redoing,
you
especially
don't
if
wanna
it's a
give
smaller
anything-
gym.
Yeah, exactly. And you don't want to give anything but too challenging that's going to make everyone so sore.
Or someone that's gonna,
into
like,
the-
they're all gonna rip their hands open.
Yeah,
You know, I
totally.
redid 17, what was it, 2 with the bar muscle ups, that one? I did
Okay.
redo that 3 times. I had like bruises on my ribs, like, I taped
Whoa.
up my ribs with pads on the last time through because I'm like, I need to get these reps.
Yeah. Well, it wasn't that right before chest to bar, right?
It was, that was
to bar
the
was
third one,
last,
chest bar
yeah.
and snatch
Oh,
complex,
okay.
yeah.
So they weren't back to back.
They,
They were, right?
they were.
Yeah,
Yeah.
It's just like people that did it 2 or 3 times on each one. It's like
Oh, yeah.
you just
Hands were just
wrecking
wrecked.
your hands, your
Yeah.
lats.
oh, my grips were awesome, so it was great.
So you said that you mentioned you're really good overhead. Do you do a lot of midline stability work in your programming, or is that just like a natural in your wheelhouse?
I would think my midline's actually one of my weaker parts for some reason. Like I have trouble if I had to get up on like for the rings, like I lose my midline. For even just bar muscle ups, I lose my midline with stuff. But if I have something locked out overhead, I could hold it for days. I don't know
Interesting.
why it
Probably
is.
positioning, right?
That and I was a gymnast when I was younger.
Okay.
You know, like I could walk on my hands, no problem. If you give me like a plate or something, we used to do it in Hoboken back in Jersey. We'd have to do a whole like a lap around the block, holding like 45s over our head.
Yeah.
You know, and I could make it all the way around, no problem, holding it up. But you know, if I give me like reps or something,
Yeah.
then it's like the range in here, like
Yeah.
the other ranges that I have issues with. But if I'm locked out overhead,
I noticed that in my own training. Like once I got a lot. I could do a lot more weight, and I didn't get stronger. And it was because I opened those joints up, and I gained the ability to like really stack joints on top of each other.
Yeah.
And
Yeah.
it like makes a world of difference.
yeah,
Totally.
like so I could hold it, like I could. Whatever, like 3+ minutes the handstand hold, but then if I have trouble doing one strict handstand push-up, you know? So it's like it depends on the range where I'm at. So it's just now, like, I mean, these are all new things for me too, being a year and a half. So I'm
exactly.
finding all my weaknesses of like, okay, I have a big list now. It's kind of
Yeah.
fun because you still see like the big improvements when it's still like something that's new too.
Yeah, absolutely.
So,
Yeah, you gonna go to the games this year? We're gonna see you in Wisconsin.
yeah. Treating
Yeah.
the athletes.
I think we're gonna be there. I think we're gonna have a booth there this year.
Nice.
But so, is there anything else? Where can people kind of follow along or support what you're doing? Or
If you're on Instagram, it's Primal Strength Doc, or on there's just a cover website. I have a website in the works, so it's just primalstrengthpt.com.
It's like a landing page at the bottom.
Yeah, so it has like my email on there and also my phone number. So if anyone has any questions, shoot me an email.
And you treat in Carlsbad.
So I'm up offshore CrossFit up in Carlsbad. I kind of do like a mobile
Oh,
PT
is that
too.
Rebecca Mudo? Is that her gym?
Jess Mudo's up there.
Jess Mudo.
Yes,
Okay.
she's up there, and Jason and Joe.
Yep.
And then kind of doing a mobile stuff too. So I do travel around a little bit depending on where. And then I'm down here at Movement RX treating here Mondays and Thursdays right now.
Great.
And Instagram, that's where you post those. I think that's where I've seen the pre-open, like people are getting ready to do the open.
A little video or little pointers on certain exercises that would really benefit. Usually they're like some of the relationships I find, so kind of pairing things together, where sometimes you see some of the prep stuff is like, oh, you have to open up your shoulders, but also open up the shoulders and then fire something up afterwards. So I try to give like a little pairing of like common relationships. That usually makes a big difference.
Oh, very cool.
Yeah.
Nice.
Awesome.
All right. Well, thanks for being on.
Thank you for having me.
All right. Thanks, guys.
Thanks for listening to Lionheart Radio. Subscribe on iTunes and Stitcher Radio. And don't forget to give us a 5-star rating. For all of your supplement needs and for show notes, visit luavive.com.